Good evening, everybody. Looking at the paucity of time, I think I'll quickly summarize the things. Basically, facial skin tightening. What are the expectations? So when we are looking at skin aging, the causes, so genetic factors, photoaging, free radical damages, chronic illness, malnutrition, rapid weight loss, and permanent stress. These are the enumerated causes. And when we look at types of aging, there is a chronological aging and photoaging. I would like to just highlight the difference between the two. Technically, if you look at fibroblasts are active in photodamaged skin, whereas chronologically aged skin, the fibroblasts are inactive. So this is one of the very important parameter. Depending on that, we can stimulate. So all the treating a photoaged skin is much more easier, and doing a fibroblastic stimulation is a good idea. Now, if you look at the Gauss photoaging classification, so there are four stages: no wrinkles, wrinkles in motion, wrinkles at rest, and only wrinkles. So classically, when we see no wrinkles in the early age group 20 to 30, early photoaging, mild pigmentary changes, there is no keratosis and no wrinkles. Then in the stage 2, what we see is 30 to 40, early to moderate photoaging, senile lentigens, and there is no palpable but no visible keratosis. And at the wrinkles at rest, third stage, there is an advanced photoaging, obvious dyschromias and telangiectasias, and the fourth stage, normally patients are 60 plus, and then we start seeing severe photoaging. Now, if you look at factors causing aging in the skin, I think this is one of the most important slides when we are considering things, especially in terms of treatment. One is gravitational force. Second is depletion of subcutaneous fat accumulation, and resorption of bones and cartilages. So if you look at all our managements and treatment plans depend on this particular thing. If we are looking at gravitational forces, so there is a dehiscence, so there is a slight laxity. Whereas when we look at depletion of subcutaneous fat pad, there are few fat pads, forehead and periorbital, buccal and nasal, these fat pads, there is a depletion. Whereas subcutaneous fat accumulation, especially in the submental, lateral malar area, is a known aging process. So when we are addressing, in fact, for these two fat pads, we need to do two different mechanisms. One, we have to inject, second thing, we have to slightly restore. Now, if you look at signs of aging, early signs, there is a dry skin, few dull and uneven skin tones, especially in the colored skin. Visibility of pores is the first thing, then there are age spots. So if you look at, this is the way it goes, then fine lines, volume loss and sagging skin. There is something very characteristic about the volume loss. Everybody is not going to lose volume, and especially the deflation that happens is not going to be uniform also. So when we are using energy devices, we should be aware of this particular mechanism. So radiofrequency devices are basically used for skin tightening. Our experience is with the Thermat CPT. Now with the Comfort Pulse technology and the total tip available, this monopolar RF is working on the principle of deep volumetric dermal heating and achieved by using alternating current. So there is a contraction of collagen and subsequent neocollagenesis. So if you look at pre and post pictures, when we see, what we are seeing is, we haven't done anything, but the ligament tightening is something which is very visible, and that's the reason the radiofrequency, it works better. Other radiofrequency devices which are available are Polaris, Reforma, Alluma, Accent and Tripolar. They all are non-consumable ones, but they need repeated sessions, and we really can't document the changes in the first this thing. Other interesting aspect is basically microneedling radiofrequency, which is really being not looked upon that much, but this fractionated delivery is one, it is controlling the depth. So I know which fat I can give. So 0.8 to 3.5 millimeter delivered by multiple needle electrodes. It can be utilized in patients with open pores, acne scars, as well as achieves a lifting of skin. The versions which are available as Scarlet, Secret, Evolastin, so these are multiple devices which are available for microneedling RF. Benefits are basically the depth of penetration can be controlled, which we are not having in our monopolar RFs. Volumetric tightening for sagging skin is observed, and there is a reduced open pores. It improves with superficial scars and acne scars. One particular thing that everybody can observe is smoothing of the skin. So if you look at microneedling RF, normally we say 2 to 3 sessions, especially for this particular case, and we can see even in the second treatment, there is an improvement and there is some volumetric tightening. Besides that, there are broadband infrared lights, there are multiple ones, but I would say these are adjuvant when I am looking at skin tightening. They are adjuvant to my radiofrequency or heating devices. Ultrasound techniques, now the micro-focused ultrasounds are available. Again, they are focusing on the subcutaneous tissue where the temperature briefly reaches greater than 60 degrees. So thermal coagulation point to a depth of up to 5 millimeters. So this depth is the maximum which is being achieved. I don't have much of experience for this, are only conservative about the facial fat loss because fat compartments are quite sensitive. Then there is HIFU, which is the latest thing available. There are variable energy things, and only concern again is we are looking at permanent fat loss. So submental areas we strongly recommend. Rest of the areas we really don't have much of experience for particular this device. Now coming to thread lift. Whenever we are looking at facial tightening, we keep on getting people who are asking, can you lift the skin, as Dr. Kandhari was showing. So I think when we are looking at, these are the minimally invasive, fast and easy procedures. There's no scar, minimal downtime, and instant and long-lasting results. Threads basically are available in lot many. They are 100% biocompatible, and there are lot many varieties available, and especially the barbed ones and the cones one. These are the two threads variety which are going to give a very stronger lift. Insertion of threads basically is leading to inflammation, which is inducing fibroblasts. So it is producing collagen and elastin. So photodamaged skin is a good option when we are looking at where there is a loss. Now coming to threads, basically if you look at pre-threads, whenever we are looking at the lower face, we can inject and basically we can squeeze the faces. So besides doing other injectables, threads are one of the cheaper options for skin tightening. See, basically when we are looking at, I just wanted to share, I'm almost concluding my presentation. I'm just going to share 3-4 photographs. These are the patients which are approaching us for skin tightening. But what we have done is basically if you look at the frame is intact, the face is slightly deflated. We can consider other modalities, but just by injecting. So coming back to fillers, that could be one of the mechanisms where we can lift out the face. We haven't done anything, just 2 ml of Voluma. Again, an interesting case. What we have done is the patient comes for skin tightening. Basically, the concern is meliomental. We have done just 2 ml of Voluma. So that injections, basically when we are looking at, we need to understand because the frame is intact. She is a good candidate for other therapies, but regarding cost and requirement for an instant result, these are the things which can be done. But still, I would like to say, this last thing, this particular case I would like to highlight, this is where we see the ligamental tightening. So these are the cases where we see there is a fat and there is a dehiscence. So these are the classical cases where doing a Thermage tightening works really well. The longevity of results are almost there for 1.5 to 2 years. And people who are averse to injections, this is a good modality. Cost is a concern.